Good afternoon, everyone. It is my great pleasure to welcome all the board members this afternoon on our second monthly meeting for 2022. And in attendance, we have Mr. George Fisk, Dr. Craig Andrade, chairperson, Dr. Mary Brophy, and also joining us this evening on behalf of the mayor is Mr. John Messia, director of our constituents. So I would like to turn the meeting over to the chairperson, Dr. Brophy.
Oh, thank you. Well, I'd like to call the meeting of the Board of Health for February 2nd to order. First item on the agenda is just approval of the minutes from the January board meeting. Do I have a motion to approve?
So moved.
Second.
Any edits or changes?
No.
No.
Hearing none, all in favor?
Aye.
So if the board doesn't mind, since we have a visitor from the mayor's office joining us, I'd like to move the item up regarding changes to the Board of Health and to a health department, and invite our guest to introduce himself. And we really appreciate you taking the time to come and fill us in on discussions that are going on regarding changes that are occurring within the city regarding a health department. So welcome, and if you'd like to introduce yourself, please do so.
Thank you very much for allowing me to attend on behalf of Mayor Robert Sullivan. My name is John Messia. I am currently the Director of Constituent Services, Community Engagement and Outreach. I do direct the Health Equity Task Force for the City of Brockton, Mayor Sullivan, and also I direct the Wellness Trust team for Mayor Sullivan in the City of Brockton through COVID-19 pandemic at this time. Thank you for being here. Thank you.
So, yeah, thank you for coming. I guess, part of the reason that the board had asked is that we're aware that there's been discussions both in front of the council and the mayor's office about a transition to a health department from a Board of Health. And just wanted to inquire about the process, sort of where we stand, what the plans are moving forward, and as we've discussed in our previous meetings, any help that the board can offer in moving forward with this transition. So just giving us an update on where things stand right now, what decisions are being made, and what plans are being put in place would be very helpful.
Okay, great. So the Mayor Sullivan has spoken with Executive Director, the head of Board of Health, Dr. Montesor, in regards to any changes that will be coming up, and he has spoken with the individuals out of the Board of Health that will be making a change from one office to the other. He did brief me in regards to the process that will be taking place, and did suggest that he would reach out to each one of you individually to update you after this meeting, and once the plans are concrete, that he can put forth that effort and make sure that his follow through goes as well as the plans are being put together. So he will be reaching out to each one of you individually. I can brief you if you'd like on the efforts of what my role working with Dr. Montesor and Dr. Herman is with the city efforts in the municipality, if you'd like that for the board, regarding vaccines, regarding PPE, regarding the self-test kits, testing facilities, percentages, things like that, if you'd like.
So am I hearing correctly that you're not able to speak to the specifics of what the potential changes are in terms of the structure that we have versus the structures that may be proposed?
That I wouldn't be able to speak. I'd have to have the mayor speak directly to you because I wasn't part of the process, unfortunately. So I wouldn't want to I wouldn't want to, jump to conclusions when I haven't been in on those meetings.
I understand.
Mm-hmm.
Okay.
Understand. Okay. All right. Given that, any other questions from the board regarding this, or Yeah, I know, Dr. Andre, there were concerns that, plans about this regarding support from the Department of Public Health and grants, et cetera, that are potential, or how this is organized may make a difference to how much funding will be available. Am I recalling that correctly, or?
Yes, Mr. Messia, it's worth mentioning that I'm sitting here at my office at the Boston University School of Public Health. I'm the Associate Dean of Public Health Practice, Director of the Activist Lab, and Associate Professor for Community Health Sciences. After finishing my doctorate, I worked for the Department of Public Health to help do a nationwide review of what capacities local public health departments and boards of health could happen, and how we might refine boards of health here in Massachusetts, and worked for multiple years as I was finishing my doctoral program in the commissioner's office for the Department of Public Health to put that information together and file a report. That report has since been updated and have clear resources to be able to tap into that. And so if there's any way I and others here at the board can help, I mean, my hope is that as proposals are being considered, we would tap into the information that is available to make sure that people can make an informed decision, recognizing the resources, the assets and challenges that can come with any particular model, and having someone as a resident and longtime resident of Brockton, having worked in that area, and also being able to bring other experts to bear to make sure Brockton makes decisions in the way that are most advantageous for them to make a completely the best decision for the sake of the town and city. I think is a worthwhile consideration. So just so the mayor knows, I think he does. We've had more than a few conversations. Again, I think there's value in having that kind of perspective, particularly the one of this particular board, having been engaged for so many years in this arena. A consultation, I think, is a useful consideration.
Most certainly. Yeah, I will pass this along and brief the mayor on your words and your sentiments regarding the use of the resources, and I'm sure he's aware of your review, but I will mention that once again to the mayor as well. And is there any other information you'd like me to pass on to him? I know he plans on reaching out to each of you individually after this, but is there anything you'd like me to pass on to him?
Well, I think the only other thing I'd say is that there may be a value in not just the mayor's office, but the council to having a collaboration with the Board of Health and the executive director of the department, so that again they can tap into the lived experience of what works and what has to work better, so that there's strong collaboration, synergy, and real world perspective. So not just with the mayor's office, but also the councils.
The council itself, sure. No, makes sense.
Yeah. Yeah, I would reiterate that. I mean, there's a lot of, as Dr. Andre is pointing out, how you restructure to meet the needs and the resources of the city, and the board's had a lot of experience in dealing with this over the last several years. And, there are different models that can be used, and we're very fortunate to have Dr. Andres with us, who has sort of an expertise in this. There's different models that can be used, and how you align this so that you get the most efficient and effective board health program for the city. I think, particularly taking Dr. Andres' expertise into consideration, so that the city, at the end of this transition, winds up with the best health program that meets the needs of our population moving forward. So,
Yes.
I agree with that myself.
Right, put the best model together, sure.
Any other questions or any other comments?
The only thing to say also, Dr. Messier, it's worth highlighting to the mayor that, there's ARPA funds that are coming. The legislature has already earmarked almost $250 million for local boards of health to try to find ways to have better capacity around data collection and management, to provide professional development opportunities for board staff members, to make sure there's resources, to be sure there are positions that have been vacant can be filled, to make sure that there's a better chance for all local boards of health and health departments to be better staffed, recognizing that this pandemic has stretched local boards of health and health departments in all kinds of ways, that this is the federal government has made these resources available to all states, and it's coming to Massachusetts, and Massachusetts is also finding ways to maybe supplement this one-time injection of resources to make sure it makes health departments whole and that there is a better capacity to meet the next crisis, whether it's a pandemic or global warming incident or any number of other things, that there's a better resources for every resident, regardless of what their zip code, and that includes Brockton. So that, and I've been on the Mass Public Health Association and working directly with legislators to be sure that Brockton gets its fair share, and that the legislature uses the resources nationally in a way that really directly supports cities like Brockton, so that they can make sure that they can do ever better when the next challenge comes.
All right, any other questions or
None here.
comments?
No,
All right, well, Ms. Missy, thank you very much for joining us, and if you could pass that information along to the mayor, we'd
Most.
appreciate it, and
Mhm.
we'll be, it sounds like we should be expecting a phone call from the mayor to discuss the situation, okay?
Yes, thank you very much for letting me, attend this, and I will brief the mayor. Continue your good work, and thank you once again. Have a good evening.
just to
Thank you.
double
Thank
check
you for
before you go, does
Yes.
the mayor have everybody's contact information, including
I can
Mr.
tell,
Fisk's?
let me take that, Dr.
He
Andre.
has mine too.
Yes,
Okay,
Yeah, I
Mr.
think
Fisk,
we
I
could
know he
probably
has yours.
render
Mr.
a little
Andre,
bit
I'll take
better.
yours right now. if you
I think
can.
he has it, but mine is 774
774
265
265
0790.
0790.
So it's just like I wrote it on the bathroom wall, since it's now recorded, but that's a whole different.
After hearing that, I don't know if I want to give mine out.
Yes.
Okay,
Uh,
all right, so I'll
I'll
pass
get
that
some
along.
calls later. I'll have to change mine.
Well, okay, so I'll pass that along. Do you need me to speak on behalf of any of the efforts in Brockton that is ongoing through the COVID pandemic? Are you good
I
with
think
that?
he's probably just as aware as we and Dr. Montesor are aware. If he knows,
Yep.
the mayor knows.
Okay.
Yep.
Okay, all right, thank you very much.
Thank
Thank you.
you.
All
Thanks.
right, have a good night.
Okay,
You too.
you too.
Thank you,
Bye-bye.
Mr. Messier.
All right, so we'll go back to the agenda as written. So the next item on the agenda is the statistics for COVID for the city of Brockton and vaccination update. So
Yes, thank you very much. I included in the agenda as I was writing it, I gave the latest, but as of this morning, we are looking at the stats for the day. Basically, we ended up having 74 new cases for the day as of this morning. And then the total active cases as of this morning as well was 583, and a cumulative total of 28,635. Total deaths, we have 2 new deaths as of this week. that brings us the number to 518. So basically, for the past 3 months, we have gone from 468 to over 500 cases of deaths. One thing I might add, if I may, and that is most individuals that die of COVID in the city are recorded as unvaccinated, most of them. And so I think the push to get people vaccinated cannot be emphasized enough, because we see the trend in the numbers or in the deaths and the documentation. People who are vaccinated, yes, they can catch COVID or they can become infected, but they do not develop severe symptoms to be hospitalized most of the time or to go to the point of death, of dying. So that's one of the big advantages that people have when they are vaccinated. The positive rate in the city as of yesterday is 13.4% of people who are positive among those who are tested. And the average daily cases is 101.4 per 100,000 individuals. And that goes within the last 14 days, up to the last 14 days.
And I assume these trends are coming down, right, compared to the previous few weeks? We're on a downward trend.
Yes, they are.
I've almost noticed also too that a lot of times that there, especially with the deaths, compared to a year or two ago, that a lot of the COVID is a contributing cause, like a third cause of death, where a lot of these people, have a lot of other problems beside that too that end up getting it. So it doesn't seem like we see as many, just that's the total cause as compared to what it was before.
Yeah, there are many people that just happen to have COVID while they went into the hospital for any number of other things, and not necessarily the cause. It may just be something that just aggravates things even more.
Whereas before, a year or two ago, that was the number one cause of death, no matter what it was. So that seems like you said, the vaccines probably are helping us out a little bit, and which is good.
Yep.
No, the vaccination the trend that has been described here in the city is exactly the trend that's occurring. Most of the patients that are dying and in the ICUs are patients that are unvaccinated. Those that come into the medical center or into any of the hospitals often they come in for COVID because a number of people are coming in testing positive, particularly with the Omicron variant, for other reasons and turn out to be positive. Is that the patients that come in symptomatic and needing treatment often have underlying conditions and need supportive care to get them through their illness. But they have a much better chance of surviving with vaccinations if they are vaccinated. So, and boosting makes a huge difference. So your immunity does wane, and I see that we're our boosted rate is low for the city. So, continuing the vaccination push and encouraging people to be vaccinated, I guess should be the major message coming out of this, because this is our only way out of this is the vaccination. And it's important that people get vaccinated. So, and it looks like your vaccinations, at least in January, have fallen off a bit compared to previous, compared to December.
Yes, I tried. Yes, sorry.
Go ahead.
Yes, I tried to pinpoint all the possible causes of the drop. So as we noticed, we had over 10,000 case vaccination in December. But then for the whole month of January, we had a little over 3,000, and to be exact, 3,457. So one of the things that we when I mean we, myself, and other health officials, including Brewster Ambulance that administers the vaccination at the Shaw Center, one factor that is responsible for the drop is other sites that have opened up for vaccination. In Stoughton, they have one. In other surrounding cities, they do have some. So people don't have to travel so far to come to Brockton just to get vaccinated. They can get it some other places. It seemed that there was a rush also before the holidays for people to get vaccinated so that they would, get their shots before getting together with relatives or to travel. That's another factor. Third, we did have home self-test kits before the holidays, and it's a good thing to have home self-test kits. However, it is an honor system where people who want to report it can report it to the local board of health or to other health authorities, but they're not mandated, they're not required. So that information doesn't reach MAVEN or the state system. Plus, you still have people who are a little bit ambivalent still, or complacent or hesitant about getting vaccinated. So there are multiple issues that we look at to see why we have such drop. But those are among the main factors that we have highlighted.
Yeah. So I think a lot of the things that if there are more places for vaccination, and you're right, pre-holiday, many people were looking to get vaccinated before traveling. So I'd expect a drop off. It's not unexpected that it's dropped off. So I think just monitoring it as we move forward would be important. And I don't know how the 3,000 compares to how things were in October and November for vaccinations, but also at that time, I think a lot of people were sort of in a steady state coming in for vaccinations. Is that 3,000 around? I'm sorry, I should have asked you this before the meeting because I hate to put you on the spot, but the 3,000 or 4,000 is about what was happening at the center, the Shaw Center, before the holiday season.
I don't have the numbers in front of me here, but the numbers were higher.
Higher.
Yeah.
All
yes,
right.
they were much higher. Because I would say that they reached Brewster Eminence reached a peak in December by 10,000. But remember when Brockton Neighborhood Health Center was vaccinating up till last September, the numbers, they did have the National Guards as well. So the numbers were much higher. So it seemed that it's decreased, that we continuous decrease that we are seeing in the numbers. So so we're watching rather the numbers for this month and see where other places, other centers, institutions that we could partner with in order to offer vaccines.
Right. I see that your next item is that you're continuing to run the vaccination clinics at a schedule. Excuse me. And how is that information getting out to the public, or the push to get folks within the city to come and get vaccinated?
In collaboration with some of the nonprofits in the city, we spread the news, and also we pass it on our website where some people can see it. But when the nurses go out, they also inform. They send the information. They pass the education. So I think one of the critics that I've heard is that the media, many of the community medias are not involved or are not called upon to help. And some of them, I think there is an issue, and I don't know really how to address that, because they want to help, but they don't. Some of them talked to me and said, well, we want to help. We know them, but we have a system to support. We cannot work all for free all the time. And so it seems that they would like to assist, but they would like to have a little bit a slice of the pie, so to speak, in order to be able to continue to disseminate the information as well. So I think that's one setback. That is because some of the ethnic media want to be involved, but so far they seem that they think that the service is being asked for free, and so there is a little bit of uneasiness there.
Are you talking radio and TV?
Yes.
Interesting.
Any comments or any further comments or?
Oh,
It's just, well, yeah, I'm not sure that there's, grant money or things available that could help support this, but, it's difficult without, the community support to make it, to get the information out without that. But I guess that all you can do is try as much as possible. I mean, this is so critical to get the information to people and get them to participate and protect themselves right now. So, but sorry to hear that. So, all right. Next on the list, I think, is the so Partners in Health. The grant is in place. It sounds like there's another potential epidemiologist that and community health worker that are in the process of being hired. Am I reading that correctly, or?
Yes, you are. The grant has provided for 2 epidemiologists and at least 3 community health workers. We did hire 3 of them. And each one has some expertise or cultural expertise or ethnic affiliation. So one had to be someone who is fluent in Cape Verdean, Creole, and Portuguese, one at least in Spanish and maybe some Portuguese as well, and then one in Haitian Creole. So we did hire 3 of them. One of them that was very fluent in Spanish, great staff, but she left for a permanent position that she said she's been looking for quite some time. So she only stayed on the job till the end of December. And so right now we are finalizing on bringing another one to fill that position, while we are also putting down all the applicants, all the resumes for applicants for the position of epidemiologist, because the other epidemiologist we're looking for someone who has a background, because the one that we have right now has been trained on the job to do it, but he doesn't have the degree that goes with it. And so since he has worked for PIH or Partners in Health, and out of despair of the moment, we brought him in, but we need someone with a much deeper knowledge in epidemiology. So we are interviewing. Probably next Wednesday, we will have our first candidates for interview.
Okay,
Any questions from?
none here.
well,
And how are they keeping up with this, the contact tracing during this phase of the pandemic, this current surge? Have they been able to keep up, or are they
No, Dr.
been
Brophy.
successful?
No, they were not able to really do it because the numbers were coming so rapidly. So it's like going back to something that um, Thomas Malthus, a friend or a colleague of Charles Darwin, mentioned when he was doing research. He said that food was growing arithmetically while the population was going exponentially. So
Yeah.
same thing would apply here. The numbers were going on so rapidly that the three of them, the three contact tracers and the two nurses, were not really able to keep up. But right now, I think we are in a better position because the numbers have decreased. I'm just hoping that we will be able to keep in place the staff needed to be able to do that.
No, I'm not surprised. I mean, I suspected it would be impossible to keep up with the contact tracing during the surge because it was such a large spike in cases that it would have been impossible. The good news is they've been trained in the contact tracing, and I think as we come out of this pandemic and go into the lull, that's where the contact tracing is going to be important. So they have their feet on the ground doing this. So.
Thank you.
All right. And any other? Okay.
Nothing here.
The nursing position has been filled?
Yes, that has been filled. And as of December 20th, we brought in the other nurse, and she's been working here. And so we have 3 nurses with slight diverse cultural background. And so we're not there yet because we don't have any more positions open. And when we advertise them, basically we don't have a broad base of applicants. And so therefore, as much as I would like to diversify the health department, but number one, we are limited with the number of people we are allowed to hire, and the number of people who are interested in applying to these positions in the city.
Right. Any questions for anyone? Comments?
Is residency still a thing with that too?
It's been discussed. Thank you. That's a good question, Mr. Fisk. I don't know yet where the city is with it, the city council, but it's my understanding that they want to have a discussion and pass some ordinances where they will make it an option, but not a requirement. I don't know the details. I don't know if they're there yet, but it's my understanding that they would like to revisit this and see how they can modify this ordinance to, prevent people. I mean, people have to live here in order to apply for a job here.
Might make it a little bit easier.
Yes.
Yeah, that may be very critical in the fact that right now the shortage in nursing around the country is, it's just massive at the moment. So, if the constraint of having to live in the city will potentially cause issues with trying to hire into any of those positions. So, if the council is moving that way, it's probably a wise thing to do so, particularly at this time. So. Okay, any other questions or comments?
No.
None here.
So, okay, health promotion, public health education.
Yes, we are continuing to see how we can invest in this. And one of the things that I am happy that I have been appointed to the mental health department because, as we all know, COVID is only one infection or one particular pathogen. But aside from that, there are existing conditions in the city. Perhaps some of them are critical to a healthy environment, healthy community. and the conditions have been exacerbated by COVID, making it more difficult for many individuals to really access services and being able to address mental health and behavioral aspects. So my hope is that as I continue to serve the city and work with the mental health department, that will be an opportunity to see where the other where we could allocate additional resources to bring to the city in order to be able to address the well-being of the city.
So thank you for that and applaud you for keeping, we've been sort of focused on the pandemic, but you're correct. There are a number of public health issues in this city outside of this pandemic that are critical to the health of individuals in the city, and mental health, drug addiction problems, et cetera. And lots of the cracks in the system have been opened up to crevices in some ways, and it's just important to keep these things active and on the radar screen, and applaud you for keeping not only focus on the pandemic, but keeping in mind that these are also critical needs within the city. And as the public health department is restructured, that these are going to be some of the main issues that are going to have to be addressed in the city. So, any other comments or questions from anyone regarding that?
I was just curious. I've noticed that, one of my pet things is that the homeless and, under the bridge, it seems like a lot of these folks have been taken care of. I haven't seen them as much anymore. Have they been given housing or homes or places to stay, or is there a reason why we don't see it now? Or
based upon my interactions with a group of service providers that meet with the mayor at least on a weekly basis, the Father Bills, the hospitals, the 2 hospitals and other staff, High Point. So all these individuals, they meet with the mayor every Monday at 1 p.m. Father Bill has been a little bit more aggressive to help to increase the opportunities to get people off the street or to provide some services. So the police also has been encouraging people to get off the street. So between those 2 agencies and what the state is providing in terms of resources, I think we have seen some actions to work to provide some at least temporary shelter to these individuals. So that's probably part of the reason that you see fewer of the homeless.
That's very good to see that.
Thank you.
Any other questions, comments?
Oh,
All right. So next item is resumption of in-person board meetings. I suspect that for now, given the situation, still being in sort of the surge part of this, although coming down, that we will continue to hold our meetings virtually and not resume in-person meetings, at least for the near foreseeable future. Any comments from folks, or anyone that would of a different opinion at this point?
no, not me.
No, not me. I'll go along with whatever is decided. I can go either way.
Okay. All right. So with that, then our next board meeting will be on Thursday, March 3rd, at the same time at 4:30. And with that, unless anyone has anything else to add to the agenda, do we have a motion to adjourn?
Motion to adjourn.
Seconded.
All in favor?
Aye.
Aye.
All right, everyone. Thank you once again.
Best wishes.
Best wishes.
Thank you.
Thank,
All right,
take care, everyone.
everyone,
Thank you.
take care.
Thank
All right.
you.
All right.